This is Chris Kell with LakelandLocal.com with just a simple test and a few corrections for knee pain. Now, when dealing with knee pain, we're dealing with a variety of issues, anything from meniscus tears to ACL and PCL injuries. And really to understand, why these things occur, we need to look at the mechanics of our movements, right? Usually with people with knee pain, we're dealing with what is called a knee-dominant individual, somebody that uses their knees as the primary hinge as opposed to their hips when squatting down to pick things up. And a simple way to test this is just to perform what is called a close standing squat. Right? So I'm going to place a step here. I'm going to place my feet together. Right? And I'm going to attempt to squat down as far as I can comfortably. Now for me, that's as far as I can go. If I try to go down farther, this is what happens. Okay, I come forward onto my toes. All right, and what you'll also notice is that my knees, I'll turn this way so you can see me here, my knees come over my toes. So in that situation, my knees are loading. I'm not bending from the hip, I'm bending from the knees, and therefore the knees are kind of taking the brunt of the movement there. All right, so in order to correct that, what I would do is spread my legs a little bit wider. I'd instruct the person to sit back on their hips, really stick their butt out, and make it a hip dominant movement. All right, I leaned forward more in that instance there. I stuck my butt out and I really kept my knees over my toes here. That is what is called a vertical tibia. Okay, our tibia is what is the lower leg here. Okay, and what was happening there is my kneecaps were pointing straight at the ceiling here. They're not angled out in front of my toes, they're staying over my toes, meaning my hip is loading as opposed to my knees. And when it comes to issues with the knees, we want to make every exercise a hip dominant exercise so we can hinge from this as opposed to this, take the pressure off the knees and really start to retrain the areas to strengthen the muscles around the knees and kind of protect this area. With that said, in order to do that, we can really use that strategy to modify any exercise. All right, so we'll take a common lunge for example. Oftentimes when I'm watching somebody do a split squat for the first time, they're going to be leaning forward excessively, and immediately I'm going to see the toe come forward, knee stays over the toe. All right? What I'll usually do in that situation is I'll instruct the person to start in a half kneeling position here. From this position, what it allows you to do is stop and reset. All right? So if you come down and your knee is over the toe, you simply bring it back, stand straight up, and drop back down. By giving yourself a target to drop down to, you're able to self-correct and make keep this hip dominant situation going on, and come up and down. And that's a great thing to do, just kind of starting from a dead stop here. The same can be done with a step up by simply stopping, coming down after each step, watching the position of the knee, standing straight up, and coming back down. Really with this, I'm trying to stay as vertical as possible, trying to stand straight up, and I'm not leaning back, I'm not kind of leaning forward on my toes. I'm really thinking about pushing through the heel, pulling my knee back over my toe, and standing straight up. With the squat, the same rules would apply. Just as I did with the test, I'm going to spread my legs wide here. I'm going to give myself a target to sit back onto, sit back on my heels, and come back into standing. All right? When we have that strategy going on, there's really no need to hinge from the knees because we have a target to sit back onto. We understand that the first movement initiates from the hips as opposed to the knees, and really we can start to safely do things like front squats where we're holding two weights in front of us, sitting back on the heels and coming back up, incorporating a box, or starting to load up maybe a split squat or a lunge where I'm using a target, I'm coming from a dead stop. It's much harder from the ground. When I push off my heel, I'm not able to get as much weight, but by the same token, it's a hip dominant movement. There's no need to hinge from the knees, and it's going to protect the low back. So